I first started experiencing incontinence probably a good 10 years ago, but it wasn't one of those things that I thought I wanted to talk to anybody about, or if I just kind of ignored it and dealt with it as best I could, that it would maybe get better on its own. I experienced symptoms of incontinence multiple times during a day, especially if I were sitting at my desk working on curriculum, lost track of time, and then I stood up and I had a problem.
Incontinence, most commonly described by patients as I leak pee, but it is the leakage of urine, and it can happen explosively. It can happen during the daytime with movement on the way to the bathroom or even at the end of urination. And sometimes they'll describe it as I dribble at the end of my urine stream.
My life before I sought out treatment for incontinence was always thinking ahead, thinking, where am I going to be? I better go to the restroom before I leave. Am I going to be at a place where I'm going to be able to go easily? It was always kind of trying to be one step ahead of my bladder. I know that sounds a little bit strange, but that's truly how bad it had gotten. When you talk about embarrassment that goes along with incontinence, to be absolutely truthful, my mother is a physician, retired at this time, but I didn't even share that I was going through this problem with my mother. And if you can't even have those conversations with your own mom because of embarrassment, think of the amount of embarrassment just dealing with people you don't even really know and ending up having an issue while you're out.
Leakage, unfortunately, is a bad problem to deal with psychologically. Patients have to worry about packing extra pads, extra diapers wherever they go. They worry about packing changes of clothes. They stop doing some of their favorite activities like swimming, bike riding, long distances, exercise. A lot of patients even stop their sexual activity because of leakage or even just fear of leakage.
I would say my major symptoms that I had were, first of all, urgency and finding myself anytime that I thought I had a minute, I was headed towards the bathroom just as a preventative measure. And I certainly had some leakage problems.
The most common thing that leads to leakage of urine is a big change or long-term subtle changes in the pelvic floor. That's usually the muscle weakens. A lot of times the muscle gets stretched out from different processes, menopause, childbirth, labor, surgery, and the muscles are not strong enough and the patient leaks. There's also the issue of the bladder itself becoming hyperactive or overactive. That's more commonly found with overactive bladder or urge incontinence.
Having first experienced incontinence about 10 years ago, and then it progressively got worse, it was really 10 years. I just kept putting it off, thinking I can handle this, it's not a big deal, until it got to the point that it really was a big deal. By the time I finally made that big decision that I needed help and I needed to go find some help, I went to a urologist and went through extensive testing and then was referred to another urologist within the same practice who did the bladder sling surgery.
The surgical treatment options for stress incontinence include the more well-known type, and that is anything that's going to strengthen the pelvic floor musculature, which usually includes the name sling somewhere in the title.
I ultimately decided to go ahead with the sling procedure because I was moving to a new school and not knowing the layout of the school, not knowing how close I was going to be to a restroom. Certainly chances were small I were going to have a restroom right in the same building. And I was going to be working with people I didn't know and certainly didn't feel any level of comfort going into a school, having this issue and maybe having an accident at the school. So that was my biggest determination, and it was time. My concerns about the surgery were really pretty small. I mean, we always, when you get put to sleep, it always goes through your mind, but they did not use the heavy anesthesia that's often used. I've had knee surgeries and really been put under for that. And I really was put at ease from the way I was greeted at the surgical center, the way the doctor talked me through the procedures. It was really an easy procedure.
The sling is essentially a wonderful invention that emulates the pubourethral ligament. So this is the main ligament that supports the urethra and makes us continent. The sling goes in and supports the urethra, especially in the area of the mid-urethra, so that when we cough or sneeze or laugh or bear down, we're not leaking anymore.
On the day of surgery, I got up and went to the surgical center, and they came in and talked to me about the procedure. They put in an IV, and literally within, I would say, a half an hour of being there, I was taken off to the surgical suite. 3 ladies in there, so nice, talked me through it. I went to sleep very quickly, and when I woke up, it was over, and I was literally in and out of the surgical center in about 3 hours.
The single incision sling is amazing. It is a very quick procedure. When I tell patients it takes 10 to 15 minutes, I'm not being a liar or facetious. It literally takes 10 to 15 minutes. It is 1 small incision in the vagina. The actual size of the incision itself is 1.5 centimeters in length at the level just underneath the urethra. 1 small incision, very small amount of dissection. The sling goes in. The incision is closed. The recovery time is short and very manageable.
When I think of the recovery, in my mind, I thought, okay, this is a big deal because this had been a big deal in my life for a long time, so it was going to be a big deal to fix this. But it was certainly not the big deal. I gave myself a week off from school, and truthfully, I could have been back on the job within 3 days without a problem. I enjoyed the extra days off and just making sure, but it was not a big deal by any means.
For the first 2 weeks, I ask for no heavy lifting, no strenuous exercise, and stay out of the pool or hot tub during that time period. If you work, drive, work from home, don't work from home, you can drive, go back to work in 3 days.
When thinking about other differences that have happened in my life, I think about the fact that recently I've been going through all kinds of treatments for my knees. I have psoriatic arthritis and osteoarthritis, and one of the problems with my knees is I certainly couldn't exercise, but I couldn't exercise because of my bladder either. And so now things are better with my knees, things are better with my bladder, and in the last 10 months, I've lost 44 pounds. So I'd like to say that that's all interconnected there to make it really, again, something worth doing. It's life-changing, and now I can exercise, I can walk, I can do all those things and not have to worry. Since having the surgery, the changes to my life have been immense. I can go somewhere and not immediately look for where is the bathroom located, or thinking, did I bring a pad along in case I have some kind of problem while I'm out and about? And it's so nice just to go and enjoy life and not have to constantly think about dealing with incontinence and how that's going to affect me in a social situation, or if I'm sitting in a meeting, how I'm going to deal with that. It's just been amazing. Another advantage, and I know this is going to sound a little bit crazy, is in having to wear multiple pads per day, I always had to make sure, did I have them? And really, there's cost with that I no longer have to go through. So if you kind of want to think that the procedure itself is a little money-saving venture, it absolutely is.
The adult undergarment industry makes almost $20 billion a year. And that's not even looking at the amount of underwear that people use and throw away, or the clothes that people buy and throw away because they've soiled them from leakage. That number is insane, and it's not fair for our patients. when they have an easy, relatively quick, and manageable option that is not going to cost them thousands over their lifetime in diapers and pads.
If I were to give a word of advice to women who suffered and are suffering in silence like I did, it would be, don't wait. I so wish that I could have those 10 years back, that I had gone and done something right away, because it really took up so much of my life and my time. And you think about the stress of constantly worrying, wow, what a difference that would have been for me. So I'd say, don't wait. It's not a big deal. It's an easy fix, and it's absolutely life-changing.